cerebral amyloid angiopathy. CAA is an age-related neurodegenerative disease of the vessels. And now the diagnosis of CAA is usually based on the Boston criteria, which is according to the MRI, mostly hemorrhagic markers. So usually you need to have some hemorrhagic lesions on MRI in the lobar area for CAA diagnosis. However, there are some other situations. For example, if you have mixed hemorrhage, like you have hemorrhage in the lobar and the deep hemorrhages at the same time, or you have some more atypical presentations when the diagnosis is not so definite. So we need other biomarkers for CAA diagnosis in addition to the MRIs. One of which is the amyloid scans, similar as in Alzheimer's disease, when you can detect the amyloid in vivo without obtaining the biopsy. So there are a bunch of studies using an Amyloid-PET for CAA diagnosis. However, the amyloid scan is very expensive and with low availabilities in most of the facilities. So we need other biomarkers, for example, the blood biomarkers for CAA diagnosis. So in our study, we try to do the investigations about whether blood biomarkers could be used for CAA diagnosis. So we test the blood levels of amyloid beta-40, amyloid beta-42, total tau and phosphorylated tau levels in CAA and compare them to hypertensive controls in which they should be amyloid negative. Amyloid naive patients, and we found that there's no roles for amyloid beta-40 and amyloid beta-42 in differentiating these two groups. But the tau levels, on the other hand, were higher in the CAA group compared to the hypertensive group. And we also do an ROC analysis to clarify the diagnostic value of tau levels for differentiating CAA from the hypertensive group. And they had a very good diagnostic value between these two groups. So I think our main study findings is showing that we could do a blood test for especially for the phosphorylated tau levels and show they are can differentiate the patients from CAA from the hypertensive hemorrhage. For most of the instance, in one of the conditions that the CAA diagnosis is important is to try to differentiate from the other amyloid disease, the Alzheimer's disease. And for the amyloid PET scans, we could not have the sensitivity and the specificity to identify CAA from those coexisting with Alzheimer's disease, because they are both A-beta diseases, and the amyloid scans have very poor resolutions in differentiating these two diseases. So at the current moment, we're trying to do more studies in CAA and as well as in Alzheimer's disease, and try to find more blood biomarkers that are different between these two beta amyloid diseases. Yeah, so of course we are planning a lot of studies in the future.